Does Wegovy cause spotting? That's a question we hear a lot, and it's genuinely worth taking seriously. Let's look at what the evidence actually says. Wegovy is a prescription medication used for weight management in adults in the UK. It contains semaglutide, and it belongs to a class of medicines called GLP-1 receptor agonists. It works by mimicking a hormone your body naturally produces, one that helps regulate appetite and how full you feel. It's a prescription injection used alongside a reduced calorie diet and increased physical activity. Now, to the main question. Spotting is not a recognized side effect of Wegovy. The medication works primarily on appetite, blood sugar control, and digestion. It does not directly act on reproductive hormones, and there's no established direct link between semaglutide and spotting or irregular bleeding. That said, some people who menstruate do report changes to their cycle whilst using GLP-1 medicines, and it's worth understanding why that might happen, because the medication itself may not be the whole story. Significant changes in body weight can influence hormone levels, and that in turn can affect your cycle. So if your periods become irregular during treatment, it may be connected to the weight loss process rather than the drug itself. Other factors can also play a role, things like stress, changes to your contraception, or underlying health conditions. It's rarely just one thing. So what should you actually do with this information? If you're using Wegovy and you've noticed spotting or any changes to your cycle, mention it to your doctor or pharmacist. Don't assume it's nothing, but don't panic either. Keep a note of when it started, how long it lasts, and whether anything else changed around the same time. That information will help your healthcare professional give you a clearer picture. And here's an important one. If there's any chance you could be pregnant, take a pregnancy test and speak to your GP. If you're considering starting Wegovy and you have a history of menstrual irregularities or hormonal conditions, that's absolutely something to raise before you begin treatment. There are also some signs that warrant more urgent attention. If you experience heavy bleeding, you're passing large clots, or bleeding is prolonged and doesn't settle, contact your GP promptly. These aren't things to wait and see on. To recap, Wegovy is not known to cause spotting, and it's not listed as a recognized side effect. Some people do notice menstrual changes during treatment, but these are more likely linked to weight loss or other factors than to the medication directly. Any unusual or persistent symptoms are worth discussing with your doctor or pharmacist. This video is for general information only and isn't a substitute for personalized medical advice. Always speak with your healthcare professional about your individual situation. If you found this helpful, leave a comment below with any questions you'd like us to cover. And if you want more straightforward, medically reviewed information like this, make sure you like this video and subscribe to the Bolt Pharmacy channel. We'll see you in the next one.